cost estimates. And I think
a major concern that was brought up during a healthcare forum was the island's present healthcare status and the structural integrity of the Guam Memorial Hospital. The Guam Healthcare Foundation has been working diligently for quite some time to plan for impacts of the healthcare for the military buildup and what needs to be done to improve healthcare and financing plans for development of a new hospital, as well as recruitment of health professionals.
With Pongsawa hit, the hospital was devastated. Did we decide, oh no, we're not going to help the government of Guam? We took the patients.
During the forum was Foundation member Ruth Gurusamy, a former Guam Memorial Hospital nurse and concerned member of the community, says she's fed up with the lack of health professionals.
Today, do you know that if you had a stroke, there is no neurologist at Guam Memorial Hospital that can take care of you? We have a neurologist on Guam, but he chooses he doesn't need to practice anymore in Guam Memorial Hospital. Is that okay for this community? Absolutely not, I will say. I'm a community member. I'm not going to speak as a nurse. And I sit at this room, I look at everybody in this room, I know half the people in this room, and I'm saying, you all accept this? The foundation doesn't. And the foundation wants the government to do something about this.
As Gurusamy voiced her concerns about the present status of Guam's healthcare, Peter Skro, president of the Guam Healthcare Foundation, says his team has always been open with their plans to improve and move the healthcare on Guam forward.
And as far as dialogue, let's be honest, Carlotta, we initiated all the dialogue. Now, you know, this is a very important issue. None of us make a penny doing this. We do this in our part-time because this is our community, and I'm going to tell you this right now is based on our new calculations. This community is going to face a major healthcare crisis if we don't move much faster.
The outcomes of the forum brought the healthcare community together to share their views on the impending military buildup. Senator Roy Respicio says the interaction brought up during the forum opened doors and helped touch base on what needs to be done in preparation for the buildup.
I think what we wanted to do here is scratch the surface, but we've gone beyond that. We've got the administration to receive a presentation with respect to how our community is going to be able to respond to what the military buildup would do to impact negatively the healthcare and the need for additional hospital beds.
Peter Skro of the Guam Healthcare Foundation said it's time that all key players of the island's healthcare community join to put concerns on the table.
Well, I think the greatest benefit at all for this was that you had people that never got together before, and although there were some differences of opinion on the approach to improving our healthcare system, developing a new hospital, it was obvious that just by this short dialogue that there were solutions that both sides of the table accepted. And you know, I'm really pleased with that. I'm really happy with that. I wish that this could have happened much earlier. There's been a lot of people that have put a lot of work and time into this, and I just thought overall it was a wonderful meeting.
Krista Augustine, Pacific News Center.